People think Thailand is a paradise for LGBTQI people and also around HIV. But in fact, if you scratch the surface, you realize that there is supportive legal policies in terms of LGBTQI human rights, particularly on the HIV issues. People don't normally want to talk about it openly. Our government is really supporting LGBTQI tourism and about how Thailand is being so open as a society, but in fact in terms of the laws and policies, that's not supportive at all for vulnerable populations. My name is Midnight. I'm from Thailand originally. I am the Executive Director of APCOM. The main work that we do is around LGBTQI human rights and also HIV. In Thailand, in the end of March 2020, we went through lockdown. And then, of course, a lot of LGBT communities are really suffering. So we started to have discussions online with 23 community-based organizations in Thailand around what are the issues that each organization is experiencing and what each of them can help each other on. And that really evolved into the work that the Atlantic Fellows are supporting around ensuring there is some evidence from the communities to be able to do some advocacy around issues that is affecting vulnerable communities that are being left behind because of COVID-19 situation. So we've done this survey and about 1,400 people responded, and the communities are then able to discuss what would be the main key issues that would like to present to their local authorities, and at APCOM level, how can we then use this information to present at the regional level through UN agencies and other donors. So the local communities are actually involved in conducting the surveys to their communities wherever they're based. They're all involved in terms of deciding what questions to ask. The grant that APCOM is receiving is really in partnership with another community-based organization called the Post Home Center, which works with people living with HIV.
ในส่วนของการสำรวจอันนี้ก็จะเป็นกลุ่มของคนที่อยู่ร่วมกับเชื้อเป็นส่วนใหญ่นะครับซึ่งจากเดิมเนี่ยเขาก็มีปัญหาอยู่แล้วใช่ไหมครับพอมาเจอโควิดปุ๊บเนี่ยปัญหาอะไรที่มันเกิดผลกระทบขึ้นมาอีก
และยิ่งช่วงผลกระทบของโควิดปุ๊บบางทีมันจะเป็นเรื่องค่าใช้จ่ายมากกว่าบางคนแบบตกงานบางทีจะมารับยาหรืออะไรบางทีมันก็มีปัญหาในเรื่องนี้ซะมากกว่าครับก็คือถ้าที่ผมได้ประสบเนาะใช่ไหมคือจะเป็นเรื่องการขาดยามากกว่าครับแล้วเรื่องค่าใช้จ่ายนะครับซึ่งช่วงโควิดผ่านมาทำให้แบบตกงานแล้วก็เป็นปีกว่าละใช่ครับก็คือหนึ่งก็คือได้แบบสื่อสารกับทางเขาว่าโอเคผมมีปัญหาในเรื่องนี้นะแล้วก็แบบว่าผมจะทำยังไงบ้างที่ผมจะได้เข้าถึงยาสเต็ป1 2 3ผมจะ
พอเดินมีปัญหาลักษณะแบบนี้มันก็เลยเป็นที่มาว่าข้อมูลของตัวนี้เราเห็นแล้วว่าปัญหาที่มันเกิดขึ้นเนี่ยเราจะหาวิธีการอย่างไรในการที่จะรับมือกับปัญหาที่เกิดขึ้นของเขานะครับ
Through our discussions, we realized that it's not just the emergency funding that the community organizations need, but also it's about livelihoods and being who they are. Most other donors want to do more like emergency funding, giving out small grants to give out food packages, water, but not really about how to empower the community to be able to own their data and use their data for advocacy. So this solidarity grant actually allows that to happen. This grant has certainly amplify the voices of those most marginalized in terms of their access to health services. What we do know also that other communities would also like to see our template of how the surveys are being done. So other communities outside Thailand could also learn from and also do the same kind of research. And I think as more and more countries do this, then it will really amplify the voices of those that are working on HIV and LGBTQI human rights in the Asia region.